Squeamish, keep scrolling. I'm going to talk about a facelift complication. These images are a little graphic. We're going to talk about how this eventually went to this. One of the things that can happen after a facelift is a hematoma. A hematoma is a collection of blood under the skin. It's not just a bruise, it's actually a pocket of blood that needs to be either sucked out or evacuated in some way. It was day one after a facelift, and this patient unfortunately had a fairly sizable hematoma back behind the ear and along the jawline. You can see that it's really bruised. In person, it was palpable, it was kind of squishy. On 3/4 view, you can see more of the bulge here of the hematoma that is settling down into her neck. You can also see the outline of the drain under her chin. Based on the size of her hematoma and the location being in the neck, I opted to drain it, put a couple netting sutures in, and then fortunately when she came back the next day, she still had quite a bit of bruising, but the neck was nice and flat. The first key is in diagnosing a hematoma. The second is in getting it out and managing it appropriately so that the tissues underneath can heal like they should. Typically, if patients have hematomas, they swell a bit more, and you can see that she had quite a bit of swelling in her neck here. The swelling itself, I somewhat anticipate. It's the palpable bulge that makes me concerned for a hematoma. So you can see that those are different here. Long term, you can't even tell that she had her hematoma. The bruising resolved, her incisions are healing nicely, and she's got a really crisp jawline. Complications happen to all surgeons, unfortunately. It's your surgeon trying to minimize the complications, diagnosing them when they happen, and managing them appropriately.